President Obama takes his campaign for health care reform to Chicago tomorrow, and he'll ask the nation's largest doctors group to get on board. But it could be a tough sell. Welcome back, everyone. President Obama has his work cut out for him with the American Medical Association because it does not want more government involvement in health care. President Obama wants to sell Congress and the country on his plan to make health care more efficient and affordable. He says letting people choose between private insurance and government insurance would hold down costs. The American Medical Association disagrees, and so do many Republicans, but some say they'll work with the president.
I am hopeful that we're on the right track. There's a lot of things that we agree on.
But voices of compromise could be drowned out by interest groups running ads for and against the president's ideas.
With all the groups involved, some people invariably feel that they are giving too much and getting too little.
If we don't act, and act soon, to bring down costs, it will jeopardize everybody's health care.
And on Tuesday, House Republicans will say they'll lay out their own plans to solve what they call the health care crisis. Now we want to bring in Dr. Tom Patterson. He is the chairman of the Goldwater Institute, former majority leader in the Arizona Senate, and you are also an emergency room doctor.
Correct.
So you have a lot to say on this. And it's a very complex subject, as you were just telling me during the commercial break. It's hard to try to, you know, narrow this down during a 3-minute segment.
It is, and we saw on the clip all the interest groups that are involved, everybody wanting to get their piece of the pie or to make sure whatever happens that their group, their interests, and their incomes basically get maintained. But, you know, what's in it for us, for the patients, for Americans? I just think it's so cool that on Flag Day we're getting to discuss what is really, when you boil it all down, an unrelenting attempt to try to take away from Americans their freedom to select their own health care, to be in charge of their own health care. I mean, that's the big question. Is government going to run our health care and make our health care decisions for us, who gets what, when, and how, or are Americans going to take back some of that more for themselves?
Are you in agreement that health care reform is needed?
Absolutely. We have a system right now that is broken. Now, Obama and his people seem to think it's broken because government doesn't do enough, and or people are left out of the big government plan. My idea is quite the opposite. My idea is it's broken because when you and I go to a doctor, I just bet you that you, and I'm not picking on you, Carrie, all of us when we go to the doctor, we have the feeling that our health care is being paid by somebody else. We don't even know what the things that we choose cost, and our doctor even doesn't sometimes know, and we certainly don't care. It's covered by insurance, so we don't mind whether it's really necessary, whether there are less expensive ways of doing things. Nothing but just the best for everybody and everything. Well, that's nice, but it's horrendously expensive, and that is why we have such health care costs that are through the roof, is that nobody is there disciplining those costs with every choice that's made, because it's free. Well, of course, it isn't free. We all pay for it a lot.
Let me ask you this. I was listening this morning to Kathleen Sebelius, who is the Health and Human Services Secretary. She was saying that we have to immediately be able to deliver higher quality care to all Americans. Right now, there are an estimated 46 Americans with no insurance. That's of big concern, and that's one of the things I hear President Obama talking about over and over again. 46 million Americans with no insurance.
Right, and that is a problem. But you do want to know that that does not mean that 46 million Americans are not getting health care. There's a lot of health care available to people that don't have insurance. And, you know, community health centers, for example, almost nobody seems to know about these things, but they do a wonderful job of providing primary health care to people without insurance. And I really think we need to get away of thinking about insurance and think about health care itself and how we get the most health care, the most basic health care, first of all, to the most number of people. And I want to say also, when you say, she says, oh, we've got to do this immediately, that's one of the big things going on now, is that, oh, it's rush, rush, rush. It's got to be done by next month, Obama says now. Well, this is a big deal, and it's going to be with us, whatever we come up with, especially if we go to more and more government control of health care. We're going to be stuck with it for a long time. And I, for one, am getting tired of these rush jobs coming out of Washington. You know, we had this stimulus bill that had to be done by the weekend, And still months later, it's still, really hasn't even been implemented.
Well, do you think he'll be able to get Republicans on board? Because nothing's going to be able to be rushed unless you have, an agreement in the Senate, and you need 60 to be able to move forward.
Well, I think the more time that people have to look at this, to think about what's happened in other countries when they've gone down this road, to really get down into the details of it and find out about it, I think the chances go down that we're going to get this far-reaching reform, this hugely expensive reform, that we really can't afford, but that Obama and his colleagues want.
It's an interesting. Historically, President Truman tried it and failed, and President Clinton tried it and failed. So I certainly expect to see a lot of talk about this in the coming days and weeks. Doctor, thank you very much for being here. As you said, it's a complex subject, but I think it's important that people try to look into it to see it so that they're informed about what's going on in Washington. Appreciate your time this morning.